once again, from my house to yours. I'm Marie Most, your church nurse. Well, yesterday I got tested for the coronavirus. No, I don't think I have it. I don't have any symptoms like cough or fever or sore throat. But I've been able to go into several people's homes to help them with the virtual doctor visits. And I'd hate to know that I took the virus into them. I figure it's safer for me to go in there and know that I'm not infected than it is for them to go into a waiting room full of people and be exposed to several of the staff members. Well, and besides, another reason I wanted to get tested was I wanted to know what it was like, get the inside scoop. So this was my experience. You don't need to have an appointment or a doctor's order anymore. You just drive up to the Bay Great Lakes Health Care Center in Bad Axe. That's right beside the thrift store across the road from Walmart. There's cones in the parking lot to help direct you in there. They have testing available Monday, Wednesday, and Friday from 10 to noon. No appointment necessary, just show up. You can get tested if you have symptoms, if you've been exposed, or if you're an essential worker. Well, and basically anybody who's working is an essential worker these days. So pretty lax guidelines right now. They asked me a bunch of questions like name, date of birth. They wanted the insurance information. Almost all insurances now are covering the cost of the testing. And if you don't have insurance, there's some programs that can help you out with that as well. So just stayed in my car. They came out in the space suits like you see on TV, and they took a swab up both sides of my nose. It took about half an hour altogether. There were a couple cars ahead of me, a couple cars behind me. I'll get the results in 3 to 7 days. So next week I'll tell you what I found out. I'm sure I'm negative. But did you know that 44% of the people who get the coronavirus catch it from someone who has no symptoms at all? That's a lot. And that's why we still need to be careful. Why we need to wear our face mask and stay at home and practice social distancing when we're out. You've heard a lot these days about opening back up, opening the economy, the state, our church. So let's just think just a minute about how this virus spreads and how that impacts our reopening. It takes a certain number of viruses in order to catch the coronavirus. These number of viruses enter your body, so just one virus won't give you the COVID infection. But after you've reached that threshold, you will become infected. So the number of viruses in the air that we breathe, and the more infected the person is, that increases your risk of catching the virus. So the more droplets that are being spread, we all know that coughing or sneezing sends out millions of viruses. But did you know that even talking can send out viruses as well? The louder, longer, and closer we speak, the more droplets are being released. Wearing some kind of face covering can reduce those numbers. And then if we stay in that same room where the virus is circulating long enough, we will eventually breathe in enough viruses to get infected. So entering a small room, say a bathroom or riding in a car with someone, increases your risk much more than if you're out in a big open area or maybe even outside. If the air in the room is being circulated frequently, windows are open, that type of thing, that reduces your risk. So let me give you an example. Let's say your friendly neighbor has COVID, but doesn't know it. No symptoms. So if you're sitting down for coffee in his home for a couple of hours, there's a good chance you will catch it from him. But if you would talk with him across the fence or even pass him in the grocery store, there's much less chance that you would breathe in enough viruses to get infected. We need to be making wise choices as we move forward. Let's continue to trust Jesus and wash your hands.